progesterone analogs like medroxyprogesterone and levonorgestrel, which inhibit growth of the endometrium, danazol, which is a steroid that inhibits mid-cycle surges of follicular stimulating hormone and luteinizing hormone, and prevents steroidogenesis in the corpus luteum, and gonadotropin-releasing hormone modulators, which cause a decrease in estrogen levels. Surgical options are available for severe cases. If the woman still wants to have children, the surgery involves only excision of endometrial implants, endometriomas, and adhesions. If she has completed her childbearing, or if the pain is too debilitating, a hysterectomy and oophorectomy with excision of any other endometrial implants is done. Whatever the treatment, once menopause hits and hormone levels fall, the symptoms generally go away. Alright, as a quick recap, endometriosis is when cells of the endometrium grow outside the uterus. These cells follow the same hormonal cycle as normal endometrial tissue, including secretion and bleeding. This causes inflammation, scarring, adhesions, and endometriomas. Common symptoms include pelvic pain and bleeding that gets worse during menstruation, and infertility.
Thanks for watching. If you're interested in a deeper dive on this topic, take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine. Otherwise, you can always support us by donating on Patreon, subscribing to our channel, or following us on social media.
So now let's start to talk about endometriosis, and now I need to explain you that point of view which you need to show to us during your classes. Very easy to start from the definition. What is it, endometriosis? It's not very difficult to memorize. In the presence of endometrial tissue outside the lining of the uterine cavity. In other words, we are talking about ectopic location of endometrial glands. Ectopic location. What is ectopic location? You had that term when you was studying such topic like ectopic pregnancy. No, I believe that you can meet the term everywhere. Ectopic means abnormal. Only one place for the pregnancy could be in the cavity of the uterus. Abnormal location of that pregnancy had the name ectopic pregnancy. Same story with the endometrial tissue. Abnormal location of the endometrial tissue had the name ectopic location. And another name of that pathology is endometriosis. No, you can find in other definitions proliferation of the endometrium in any site other than the uterine mucosa. Well, good definition doesn't matter. I believe that you will get it in your mind. Guys, I'm gonna close my conference because it's difficult to hear every time. Ding, 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 ding. How do you think when was found one first find first information about endometriosis? More than 100 years ago. More than 100 years ago. And the first steps for the treatment was made in the beginning of the age of laparoscopy. Carl Them is a very famous surgeonist. It was the first person who started to do surgical laparoscopic operative maneuvers and manipulations. He was the first person who made first operation for the persons with endometriosis. But first information was found and first definition was found more than 100 years ago. No, it's a big time. And the question is why we talk about endometriosis until that moment. Well, because that disorder is very strange and very dangerous. You need to remember and you need to memorize that endometriosis has the signs of different pathological processes. Sometime you can ask me, and you can ask yourself, if we are talking about abnormal location for the tissue, why we don't talk about tumor? Why we don't talk about oncological processes? No, actually, endometriosis is very close to oncology. Why? Because if you have abnormal located endometrium, you can expect that the life of that endometrium will be same like the life of the endometrium inside the cavity of the uterus. And one of the stage for that endometrium is the stage of proliferation. And proliferation of the endometrium, in case with ectopic location of the endometrium, means the formation of the growth inside the tissue around the primary seat. And infiltrative growth is one of the signs. It's very typical for the tumor, very typical for oncology. One more thing, we know that the oncological process can get dissemination through the blood and lymphatic vessels. Same story with endometriosis. Same story with endometriosis. Same story with endometriosis. Dissemination is very important. One more thing, around of endometriosis, we can't find with you capsule, which usually can be formatted. No, for example, in a case, if I talk about myoma of the uterus, if I talk about tumor of the ovaries, absence of the capsule is the important sign of the tumor, important sign of oncology. But it's not oncology, not oncology. Why? Because we can take all cells of that endometriosis and that cells will be same. We will find the structure of the cells and that cells will be like endometrium. No independent progressive growth. We don't have with you fast progression of endometriosis, very slow progression, very slow growth inside the tissues. We have the serious relationship between clinical picture and menstrual function. And that endometriosis could be treated with help of pregnancy. It's a typical sign for the oncology. Oncology usually should get serious progression during the pregnancy. In case with endometriosis, we expect for the slow growth of the endometriosis or the absence of the growth of endometriosis. Sometimes old gynecologists tell that we can use for the treatment of endometriosis pregnancy. One more thing, that disorder are very common and main period of life which should be affected by endometriosis is the reproductive period. That's why that disorder is social important. reproductive period is the main period, and result of that disorder could be serious trouble with the pregnancy, with the fertile function. We don't know through incidence. Some books tell that until from 1 till 50% of all infertile persons could be affected by endometriosis. We don't know exactly, but different books can show different results to us. Any person in the world could be with endometriosis without difference. If you are talking about polycystic ovarian syndrome, no, you know that main race with polycystic ovarian syndrome is Asian. Да? If you are talking about myoma of the uterus, African woman. For endometriosis, no, we don't have such discrimination. With help of histological examination, we can find not only endometrial glands, we can find around the glands serious inflammatory. And that is why endometriosis had the signs of inflammatory. Like tumor, like inflammatory process, not like tumor. We don't know what is it actually until that moment. We know what is it, but we don't know why that disorder is such strange. What are the typical places for endometriosis? Pelvic and extrapelvic. Could be endometriosis of specific places. Umbilicus, scars, lungs, other places. Was described endometriosis of the brain, was described endometriosis of the eyes, was described endometriosis of the kidneys. And that's why pathogenetic theories are different for endometriosis. If we are talking about pelvic endometriosis, we could split that endometriosis by two big groups. Endometriosis of the myometrium or uterus, which had the specific name adenomyosis. Take a look for the picture. It grows inside the myometrium. Or extrauterine endometriosis, ovaries, pelvic peritoneum, fallopian tubes, vagina, bladder, rectum, pelvic colon, ligaments. Typical seats for endometriosis. Surface of the uterus, peritoneum, surface of the ovaries, fallopian tubes. Here you see one of the picture, which I'm going to show you in the future. Endometriosis of the Douglas sac, peritoneum of the Douglas sac. Adenomyosis grows inside myometrium. What about theories, guys? Endometrial implantation theory is the main theory which play maximal role in the formation of our knowledge about endometriosis. Retrograde passage of the blood of the endometrium, mechanical growth during abortage, during curettage. But with help of that theory, we can't explain extrapelvic location. How can we explain retrograde implantation of the endometrium if we have with you endometriosis of the lungs? Very difficult. That's why we have with you another series, immunological or and composite theory. Theory of the development, in situ development, metaplastic theory, induction theory, embryonic cell nest, Wolfram ducts troubles, Müller ducts troubles, germinal epithelium of ovary can formate endometriosis. No, very difficult to imagine with help of just small words. That's why let me explain why that series can play a role. typical structure of the internal genitalia: vagina, uterus, fallopian tubes, and ovaries. As you remember, way from cavity of the uterus to the vagina actually split. During menstruation, stage of disc formation means that functional level of the endometrium should be passed through the cervical canal inside the vagina, and we call that process menstruation. But don't forget that the way from the cavity of the uterus to the fallopian tubes is free too. We have to view contractions is a normal condition during the menstruation. And actually, uterus can push endometrium not only with help of correct way, but can push endometrium through the fallopian tubes. And that endometrium can't find the place for the future growth. That's why typical places for endometriosis are the face of peritoneum, the face of fallopian tubes, and the face of the ovaries. Very easy to explain with help of retrograde theory. Why that theory is most important? Because prevention of the retrograde passage of the blood can prevent endometriosis. Very difficult to do it, but we have scientific works about that story. And now I'll try to tell you some moments which can improve it. We have to view such predisposing factors. Hyperestrogenism, one of them. Like the result, in case a female will be with hyperestrogenia, we can expect for formation of the extra volume of endometrium. And chances for retrograde passage of the blood through that endometrium, through the fallopian tubes, higher. Delayed marriage and infertility. It means that position of the uterus will be retroflexio or anteflexio before first delivery. And like the result, we can expect that that position means formation of the trouble for normal passage of the blood outside through the cervical canal. And young age delivery decrease the risk of the formation of endometriosis. Hyperestrogenism could be result of different tumors or something else. Persons with the tumors will be in the group risk for endometriosis. Stenosis of the cervix is a very important thing. Stenosis of the cervix can permit trouble with normal passage of the blood. Curettage, it means that with help of mechanical maneuvers, we can move some endometrial glands outside through the fallopian tubes inside the cavity of the abdomen. Insufflation of the gas or fluid inside the cavity of the uterus with help of hysteroscopy or something else. All that factors should increase the risk of endometriosis. If you are talking about classification, uterine endometriosis or adenomyosis could be divided by two groups: diffuse and localized. Diffuse is the situation when the endometrial glands inside all myometrium. Localized is the local affecting of the small one place. Like that. See, you see at the right part of the screen localized type of endometriosis. If we see with you diffuse affecting, we name it diffuse form of adenomyosis. Could be endometriosis of the ovary, cystic ovary, formation of the glands at the surface in the beginning, or formation of the big cysts in the big stage of that disorder. Could be formation of the bilateral endometriosis or unilateral. And that cyst will be with the specific chocolate inclusion inside. What is it? Chocolate is just changed blood. Formation of the endometrium inside can result in the formation of the chocolate inclusion. So like that, chocolate cyst in the ovary. Okay. We have the person with endometriosis. We know that that person in a group risk for endometriosis. We know that the person had the chances for endometriosis. How can we find that endometriosis? Very often we have trouble with the diagnostic process. Very often. And several years we can lose to find endometriosis. And different troubles, and one of them is the old admission at the hospital for the persons because the absence of the indications. It looks like that. We have to use in the beginning of our diagnostic process symptoms and history. After that should be science, and only after that investigation. What trouble with the symptoms, guys? Main trouble with the symptoms. What kinds of symptoms are typical for endometriosis? Take a look. Different type of pain. Different type of pain. Dysmenorrhea, dyspareunia, dysuria, trouble with the defecation. It looks like that. Person has in the first stage of the disorder pain during menstruation. How do you think? Will she go for the doctor with the pain during menstruation? No. She gonna ask her mother, her sister, her friends, and ask why I have such trouble. They gonna tell it's okay, don't worry. And usually we meet the time at that moment. Female gonna go for the doctors only when she will be with the serious clinical symptoms. But period from the beginning of endometriosis till the moment when female will be in investigation could be some years. And all that years female will be without diagnosis, because main trouble with her will be dyspareunia and dysmenorrhea. After that, she can meet bleeding, cyclic menorrhagia could be, in case if progression of growth will be inside the bladder or inside the intestinum. She can meet hematuria, cyclic bleeding per rectum, or something else. It means that we have with you serious stage of endometriosis. No, very rare, guys. Menorrhagia can be, but another types of the bleeding, very difficult. But what infertility is the most dangerous symptom for endometriosis, and usually we have the persons with endometriosis with infertility. First step of the development, dysmenorrhea, menorrhagia, no, actually is not the reason in the mind of female to go for the doctor. And only in case when she meets infertility, she will be with us. No, sometimes She can feel mass, sometimes another troubles can be, but guys, pain, bleeding, and infertility, three main signs of endometriosis. We can check her, but by the way, why female will be with the bleeding, with the pain? Take a look for the picture. Try to imagine what we have. We have if you sit at the surface of peritoneum. Not somewhere here. And grows inside the subperitoneal space. What should be here? Nerves. And some moment could be irritation of that nerves. By the way, don't forget pain receptors. The numbers of the pain receptors at the surface of the peritoneum, the most rich of pain receptors tissue in our organs. And when female will be with the pain, in a moment when she will be with menstruation, what is that menstruation? Desquamation of the tissue outside. What is the date of the menstruation in case if female with endometriosis? Same story. Endometrial glands should go outside from the primary seat and formate irritation of the peritoneum. Like the result, that person will be with the serious pain during menstruation. Mechanical activity inside the vagina in case with sexual contact means the formation of the irritation of that place where could be endometriosis. Same story. Dyspareunia and dysmenorrhea, two main symptoms of endometriosis. How can we check the person if she has such troubles? Make a break, 5 minutes, okay, guys?